You're rolling. Okay.
I'm glad to say that the WHO-led joint mission with China on COVID-19 is moving forward. We expect the full team to touch down over the weekend. The mission consists of 12 international and WHO experts and a similar number of national expert counterparts from China. I want to say again, from my heart, that this is the time for solidarity, not stigma. There are warning signs that the world is not hearing the call for unity and standing in unison with those at the epicenter in China who are saving lives and alleviating suffering. I again repeat, this is time for solidarity, not stigma.
The fact that there are over 1,700 cases amongst all of the cases of COVID is very sad news. But we've seen this before with MERS, we've seen this before in SARS, we've certainly seen it with hemorrhagic fevers. What we need to be able to do within that, and what we are doing with Chinese authorities, is exploring the time period over which those occur. Our understanding is that the cases amongst health workers peaked in the 3rd and 4th week of January, and there's been a rapid fall off in the number of cases that have occurred in health workers in the last 2 weeks. This may reflect increased levels of training, increased levels of protection, and also increased levels of awareness. Remember, this outbreak has expanded very quickly in an unsuspecting health system. So we also need to look at how many of those health workers were exposed unknowingly within a clinical environment, and how many were wearing protective equipment, how many had training. There's a whole load of factors we need to look at. I think people need to recognize that scientists collaborate regardless. They get on with it, and they've been collaborating, are collaborating, and will continue to collaborate. This is obviously a tense political environment because of the economic issues and because of everything else. Please, let our scientists get on. Let our public health professionals get on. Let them work together, and we find answers to this. And as the DG said, maybe we should try, all of us, to avoid politicizing this situation right now. It is not the time for us to start public recrimination. Everyone needs to focus on their performance now, and they need to focus on getting the job done. And the last thing you tell to someone that needs to get a job done is that you didn't do your job last week or the week before. That doesn't support performance. What supports performance is getting people to internalize how they can improve and get on and do it. So we will have that discussion, and we will learn the lessons, and we are constantly in touch with our colleagues in China and the other countries. But we will wait for any forensic investigation of this response until we have achieved further success in containing this virus, we hope.